In this lesson, we'll review various types of insurance cards, including some of the common ones you might see patients come in with. You'll also be able to print out a job aid on becoming familiar with insurance cards with an overview of the key information to look for, as shown in this lesson. As a result, you'll be able to identify cards and where to find key information, describe the 4 parts of Medicare, and distinguish an HMO card from other insurance cards. Medicare covers adults 65 and older, qualified younger adults with disabilities, and those with end-stage renal disease. The Medicare program has 4 parts. It's important to verify which Medicare parts a patient has. All people eligible for Medicare get Part A. Most people purchase Part B coverage as well. Part A is for hospital inpatient coverage. Part B covers doctor visits and some vaccines. Part C is when Medicare reassigns their A and B benefits to Part C. When they do this, the patient no longer has Parts A and B. They have C instead. Think A plus B equals C. Part D is for prescriptions. We'll review Part D in a moment. This is a traditional Medicare card. It shows coverage for both Part A hospital care and Part B doctor visits. As of 2013, the Medicare ID is the patient's Social Security number plus a letter. This may change in the future. This is a sample Medicare Advantage card for Part C. Remember, that's equal to Parts A and B together. Some Advantage plans may also cover Part D prescriptions. If you're not sure, you'll have to check the patient's plan and current benefits. The Advantage card is issued by a private insurer that contracts with Medicare. In this case, Blue Cross Blue Shield. The arrow shows that the card says Medicare Advantage PPO. It also shows the subscriber number for Chris Hall and the group number, both pieces of information you may need if you have to check on this patient's coverage or benefits. Contact information for the insurer is usually on the back side of the card. This is a sample card for Medicare Part D, which covers prescription drugs and certain vaccines. Sometimes it's called a Medicare Supplement card or a pharmacy card. Like Medicare Advantage, Part D cards are usually issued by a private insurer contracting with Medicare. In this case, Health Net. The look of the card may vary, but it will always show the patient's name, ID number, group number, and effective date of service. Information on how to contact the plan is usually on the back side of the card. If a patient presents for immunizations and has Medicare, ask them for the card they give to their pharmacy. Here's an example of a Medi-Cal card. It's sometimes called a BIC card, meaning Benefits Identification Card. It lists the patient's unique Medi-Cal ID number, name, sex, date of birth, and issue date. With the exception of infants 30 days old and younger, each participant should have their own card. Per Medi-Cal guidelines, it's a good policy to request the card and verify the person's ID. This is a sample private insurance card for Blue Cross Blue Shield. While plans and cards vary greatly, they have several things in common. The card lists the patient's name and unique ID number. Typically, for Blue Cross, the ID number will begin with a 3-letter code that identifies the subscribing company to the health plan. There will be a group number, a plan number, and effective dates. Often it will list that the plan is a PPO, or Preferred Provider Organization. Generally, PPO plans require your clinic to have a contract in place in order to receive payment. That will allow you to bill them as an out-of-network provider. If your department has a contract with the insurer, you should bill patients at the in-network rate. If you have no contract, you should check to see if the patient's PPO plan includes out-of-network benefits. That means the patient's insurance should be valid at your clinic. This is a sample HMO card, meaning Health Maintenance Organization. You can usually recognize HMO cards because they should include the letters HMO on the front. It's helpful to be familiar with common local HMOs, like Kaiser. The most important thing to know is that most of the time, HMOs will not pay their enrolled patients to go to an outside provider, including the health department. That's because HMOs already pay their network doctors a monthly set rate, also called a capitated rate, to give immunizations and provide other services. In rare circumstances, a local HMO may contract with the health department for specific services or allow a member to get a one-time service. In such a case, the client must have a written authorization from the HMO noting the specific service and date range it's valid. Now please follow the instructions to take the quiz for this lesson. It'll look familiar. It's the same one you took before viewing the lesson. This time, you'll be able to see the correct answers as you respond to demonstrate what you've learned. After you've completed the quiz, you may continue at your own pace to view subsequent lessons at your convenience. The lessons are ordered so you'll build your knowledge of each part of the billing process that relates to your role. When you finish all the lessons, you'll be able to print out a certificate of completion to reward your efforts. Thanks for your attention. Please continue on to the quiz.